All right, and I'll turn it over to you, Sharon, if you're ready.
All right, great. Well, thank you everyone for allowing me to come here and share with you a little bit of our resources on disaster engagement during the time of COVID-19. It just seems like during this past year, we've had every type of disaster that occurred. We've been dealing with the COVID-19, we've been dealing with wildfires, drought, tornadoes, floods and stuff. And so what we've been doing at the National Institute of Environmental Health Sciences under the worker training program that now I'm the acting director of, is really look at how do we adapt and retool some of our existing resources, and how can we make them relevant and add on either additional modules that really focus on COVID-19. And so what I'm going to try to do today is to share with you a little bit of the information that we have available. So next slide. We have been doing a lot of great work, and the WETP is providing essential and OSHA required training for workers from many sectors who may work in hazardous environments. For example, the work that we've done with our National Partnerships for Environmental Training. This is a community college consortium. They've been working in 5 different bases in the Midwest, and then also to train retired veterans so that they can get work and get certifications in hazmat in California, working through different labor unions like LIUNA and other groups to work on funding work dealing with hazardous work and recovering from disasters. And what is most important is that each of these trainings and activities that we're doing, we work with the organization or the company to make sure that we are providing the best level of training that we can. And so what we're going to try to do is that we build those collaborations. And so we want to make sure that whatever materials that we develop in our program, that we also share with you here today. So next slide. This is a summary of all of our programs that we have in worker training that we oversee and administer. We have 4 of those programs. And then we've also received, excuse me, I needed to update that one. The Ebola biosafety has ended, and we are now moving forward with our COVID, but we got a couple of supplemental monies to do that. But we've been working in these areas for quite a while. In our activities under our major program, we have 4 programs: our core hazardous waste, the one that focuses on a lot of the stuff that we're talking about as far as disasters and hazmat disasters, the second. And then another optional program is our environmental career worker training program. And we have other funding that focuses on working around, cleanup of Department of Energy nuclear sites. And then we also have, of course, mandated by Congress, a small business innovation research e-learning program. But each year we have trained we train over 140,000 individuals in all of these courses. And what is amazing is that we've been able to do training in each state and province. And we've been able to expand over the last couple of years to a lot of places that don't necessarily get a great amount of training, which is Puerto Rico, the Virgin Islands, Guam, and some other programs because of our new funding that we did in 2020 to try to address some of those issues. Next slide. I just wanted to make sure that you understand where we get our funding and how we focus on. All of our work is focused on the 1910-120 standard from OSHA, which is considered HAZWOPER, is the basis for what we do. Under this standard, we look at hazardous substances defined as any biological agent or either disease-causing agent. And so our programs are very broad. So there are other federal laws, OSHA standards and regulations that we provide training on, everything from infectious disease, disaster response, and now, of course, with our new work around COVID. Next slide. And one of the things that I think is so important is that OSHA develops great training dealing with the general duty clause. And we also have some best practices in reference to OSHA that we work with. But what we try to do is we make sure that all of the training, whether it's OSHA 10 or OSHA 30 for general industry or with construction, that we actually add on either additional modules that can expand that training to look at different hazards right now. So for example, some of our grantees, because of the work that they're doing with OSHA 10 and OSHA 30, they've added on an hour on module on COVID-19, talking about the characteristics of SARS-CoV-2 and why it's important that workers understand the engagement and what the rules are around that. So we want to make sure that we are looking at all these different programs and then incorporated into it. Next slide. This slide is very important, and it really, over the last 10 years, we've really used this all hazards approach to health and safety training that addresses training and education preparedness to prevent, protect, and respond to and recover from all different types of hazardous exposures, everything from terrorist attacks, major disasters, and other emergencies. And one of the things that's so important is that we want to make sure that we deal with all the areas. So it's not just workers per se, it could be communities. And we give training courses to community members to increase their knowledge and skills on how to protect themselves and their communities against hazards. And we want to focus on making sure that the training is broad and we address all the different hazards that come up. And so the structure of our training program is evolved so that we are looking at all different hazards, and we're looking at different communities and activities on how we can develop the best tools and resources. Next slide. Wanted to share with you some of the work that we've been doing in environmental justice, and I'll share a little bit more with you about our environmental career worker training program, because that's one of our largest programs that focus on engagement in environmental justice. And what I think is important is that we want to work to work with a lot of underserved, marginalized communities that have not had the best level of training. So what we want to do is we adapt a lot of our curriculum to address occupational health disparities and environmental justice concerns. We develop training that is multilingual and that people who have limited English proficiency can do. So for example, in our trainings that we developed for COVID, we made a decision early on that we would do language, we would focus on language justice. So we have had all of our training at least being translated in real time on all of our webinars and our materials into Spanish. And then some of our other trainings that we've done, if we're working with a different target population, we would be able to actually translate that into other languages. We're really focusing on expanding our partnerships with different groups so that we can provide them with a quality level of training. And like I said, we've done that with a lot of our training programs and our workshops dealing with eliminating health disparities, the work that we've done on different environmental justice conferences, and that will continue on with the work that we're doing with our Health and Human Services Department for the federal government and our environmental justice workforce. Next slide. So briefly, I wanted to share with you one of the things that we've engaged us since actually 2019, as I'm a member of what they consider the Federal Environmental Justice Interagency Working Group. And that has changed. It is now the White House Environmental Justice Interagency Council with the new executive order that has been signed by the Biden administration. The same goals here are same, is that we work to really focus on addressing environmental justice and for different minority and underserved populations. We're in the process now of developing new protocols and pilots that address what we consider Justice 40, which is the Biden administration approach to try to provide 40% of the derived benefits of all of our environmental and programs go to environmental justice communities. And we really want to look at bringing all these federal resources together so that we can help communities build their capacity to respond. Next slide. One of the things that we've been able to do is I'm the co-chair of the EJ and Natural Disasters Committee, and we've been working on a report where we are actually trying to focus on what we consider the best approaches to address EJ communities and that are vulnerable to natural disasters and preparedness and response and recovery. So what we've done over the last couple of years is develop a process that we work in collaborations with community-based organizations, state, local and federal agencies to really understand what the impacts of natural disasters on our communities. And so this report will provide some recommendations for future improvements in addressing EJ and other needs. Next slide. We've been able to do this by doing focus groups, interviews with different community members. We've gone to several different workshops, and one that we did here was working through PEPH and a session that they did on environmental health disparities in 2018. We also went to NIEHS meetings in 2019 and 2020, but we also did a series of town hall meetings starting in January of 2021, and they focused on 3 different geographic areas. The Southeast town hall meeting, as you can see from the slide, we had a Gulf Coast, and then we had a West, Southwest, and Rocky Mountains and the Plains virtual town hall meeting. And all of the materials that we have from that meeting and the presentations that was done by community members is up live. And so what we're doing now is our contractors are working on developing a report. And some of the questions that we asked on this is, how can vulnerable communities better prepare for natural disasters? What can be done to support them during this different phases? Are they aware of success stories or lessons learned that can be documented, that can be shared, and hopefully those best practices can be developed into case studies? And then, of course, what action should the federal government take to address EJ as it relates to natural disasters? And in addition to these town hall meetings that we did, we also offered disaster response training from grantees for the worker training program. So each one of them, the first one focused on floods, hurricanes. The second one actually dealt with flood and the freeze that actually happened in the Gulf Coast, based especially in the Texas area and other parts based on the losing power. And then, of course, in the West Coast, we focused on wildfires and other types of impacts to those communities dealing with heat and drought. And so we encourage you to go to that webpage to find out more about what's going on. And also when we publish the report and really share with the community about what are the next steps that federal agencies will do in order to be able to operationalize these recommendations. Next slide. Now, this is what I consider our bread and butter of what we do as far as our disasters. Our disaster training priorities include just really instilling a more robust understanding of the impacts of exposure to extreme temperatures, teaching workers how to recognize increased temperatures can interact with air pollutants, looking at all different types of training that really looks at improving training to recognize all different types of hazards. And we've done this through all different types of work. We've responded to multiple natural disasters. And I'm going to share with you just a little bit of the work that we've done and the training and tools that we've developed under our programs. Next slide. As you can see, we've been involved in a lot of different activities. And how it works for us is that we provide funding to our grantees to develop these tools and resources and work with communities and businesses to provide this training. In a disaster, we deploy all the people who receive funding from us to go out into communities and help out with the response. As you can see, we've trained, everything from the World Trade Center, 9/11, to recently Hurricane Florence and Michael. And we've trained over hundreds of thousands of workers in all of these response. And what we do is that we usually get supplemental funding from Congress to go out and we activate our training program so they can be deployed. And we have an emergency support activation plan, which is built in to the Worker Health and Safety Annex for a national response framework. So we get deployed to do this work and we coordinate all of these activities with our grantees. Next slide. So from this slide, you can see the different types of areas that we have worked on. And this one, we really kind of couched it as what we've been doing with climate change. I think it's a critical challenge for worker training and has an important role to play in our efforts to tackle the climate crisis. So we've been working with wildfires and mudslides, which I'll share a little bit more information on that. We've been able to leverage expertise to train workers on firefighters and other wildfire consequences, such as training on debris and ash cleanup, wildland urban interface, wildfire smoke safety, and disaster response. Of course, I shared with you a little bit more about what we do with flooding and hurricanes. And especially over the years, we've been working primarily in Texas, Florida, Puerto Rico, and North Carolina in response to Hurricanes Harvey, Irma, Maria, and Florence. And we've been working with a lot of groups, like, for example, in Robeson, we had a great number of our grantees come and work with the loan recovery group there, and we continue to provide training as necessary for community-based organizations, and a lot of those what we consider VOAS, those volunteer organizations that assist with disaster when they come. So if it's Catholic Charities or UCOR, they come out and we provide additional training to them to make sure that they understand the hazards that are associated with their response if they're actually training homeowners and other folks how to clean up their homes. We recently received funds in 2019 to do funding on disaster relief, and we've been able to actually add those funds to 7 grantees, and they're finishing up that work now in 2021. And I'll share a little bit more about that, but it's a focus of different things dealing with environmental justice, natural disasters, and things. And then, of course, infectious disease dealing with COVID-19. And so I'll share a little bit more about all those. And this is what we've been really focusing on to address a lot of the impacts of climate change. Next slide. When you look at what we've been able to do, and I just want to give you just a little brief understanding that we've had all different types of past responses. And for example, even with the Flint response, a lot of our grantees implemented training to prepare workers to replace pipes and other construction and plumbing needs. Of course, through our environmental career worker training program, we established a new program working with the building trades there, where we're training around 25 different workers each year to get into the construction trades, to get a career, so that they can help with the plumbing needs. We've worked training folks and dealing with lead awareness training and workers and volunteers and helping with water testing kits and distribution. And some of that work still is going on right now to make sure that all of the folks who actually want to get training get that training. In the 2016 Louisiana floods, we offered multiple courses to over 300 workers with several small businesses located in that area. For example, OAI, they have a long time collaboration with Mendez Environmental, which is a small business in Kerner, and they actually provided asbestos and mold training in English and Spanish to anybody who needed it as a result of those floods. And so what I think is so important is that we really want to work in collaboration with you and other groups to provide training that's necessary. Next slide. Another area that we've done was Hurricane Harvey. With this particular mission assignment, I think one of our greatest things that we were able to do with the chemical workers and with the Partnership for Environmental Technology and Education is to work to actually go and be deployed and train people where they were during Harvey and some of these other groups. And what is important is that when our trainers go out, they go out and they go to anybody. We work in the Joint Field Office and we provide any type of training that's necessary that we have under the training of our grantees. For example, with the picture here with Ron Snyder, he was demonstrating the use of half-face respirators to AmeriCorps volunteers as they cleaned up homes in Houston, Texas. And we wanted to make sure that we understand this is really important in reference to hands-on activity. The same thing in reference to Irma and Maria and Florence. We made connections with state and federal local agencies, and we actually offered disaster training courses in multiple states. And a lot of that was done in Robeson County here in North Carolina. Next slide. This is just another example of some of the work that we've done. We partnered with the local worker center during Hurricane Harvey called Fe y Justicia. And we were able to actually do hurricane awareness trainings in Spanish for hundreds of individuals to protect themselves while clean up. And a lot of these are groups that never really had an opportunity to get this type of training. And then we also had folks that came down from our training from the New Jersey, New York Consortium, a group called World Cares. This is a picture of Lisa Orloff conducting hands-on training on muck and gut and working with the homeowners and folks who are volunteering in Houston to do that. And as you can see, We just look at how we actually address this. And that picture down on the left-hand side was actually a picture that I took when I was riding down the road in Houston. One of the things that we see happening across the board is that a lot of rules and laws are suspended when there's a hurricane and flood. So one of those things is a worker health and safety and work zone safety. This is a truck that we saw going down the road. And as you can see from this picture, they were packed up. I mean, just with so much material, so much debris. And at any other time, they would be pulled over and given a violation, but not now. They were able to do all this type of stuff. And we want to try to work to say, this is not the best way to do, work zone safety when we're dealing with hurricanes and disasters, because it just makes things 10 times worse. So next slide. In 2019, I was able to go out to California to work with our Western Region University Consortium when they were training National Day Laborers Network at their Pasadena Job Training Center on wildfire awareness training in Spanish. And what I think is so important is at that same time, there are wildfires going on, burning in the Malibu Hills. And we were able to really talk about the specific standard that was being developed out in California, how to do training and make sure that it is multilingual, and all of the materials and tools that we developed in collaboration with this training was made available in English and Spanish to all the workers there, but they allowed us to come in and actually provide this training. We also have tools and resources that we have for worker training, on wildfire training. We're in the actually process of revising our wildfire training tool to make sure that we're looking at the new existing rules and regulations that specific states have developed dealing with wildfire and drought. And so we're going to continue doing that. And we also did a briefing to Congress. Our director, Rick Warchak, and one of our grantees from the Firefighters Association shared what we've been doing under our training and how we've been able to respond to wildfires. And so we actually have some great resources. In the next slide. On our webpage, all of these resources are available. And as you can see, our training tool for wildfire disasters, for Ebola, infectious disease. And so these are the big things. So now what I want to try to do is in these next 10, 15 minutes is talk about how we've been able to adapt the training that we've already developed and utilize it during the time of COVID. So next slide. We really started working on infectious disease way back with the bloodborne pathogen standard. We've actually done more biosafety work with H5N1, the anthrax attacks, mold, and then of course we received $10 million through an emergency appropriations to do Ebola virus safety preparedness training. And what we've been able to do is adapt all of the training that we've done by using that the approach that we talked about all hazards, to adapt the training that we do to make sure that we're able to utilize it with COVID-19. And so I wanted to really share with you what we've been able to do and kind of how the progression of how we've been able to do this. So next slide. So with our Ebola training, that began in 2016 and ended in 2019. And so we were really ready to really move forward to say, these are some of the things that we've done as far as in biosecurity, biopreparedness, and rapid response dealing with infectious disease. And one of the key things that we looked at was the pathogen safety data sheets. And if and MERS and other novel coronavirus pathogens were already in that pathogen safety data sheet. So we were able to utilize that those resources to develop trainings dealing with Ebola and other types of pathogens, so that we were able to move forward with this particular training. And so what I wanted to share with you is that we were able to work in collaboration with our partners at the CDC and Health and Human Services, NIEHS, and OSHA to really develop training that was specific to dealing with Ebola or biosafety under this program. Next slide. Here are some of the various occupational sectors that we trained here. So it was really, really broad, everything from healthcare workers to airport workers, airline workers, other folks dealing even with nail salon technicians and other healthcare workers when we were looking at that response. And then, of course, what we were able to do when 2020 came around, and the next slide dealing with coronavirus, is that we were able to adapt very quickly the work that we had done with the Ebola safety training, and all of that material that we've developed under that training program is still available in our curricular catalog. And we're also trying to make sure that now all of the different trainings that we developed on the different pathogens and additional tools are now going to be available. We're going to move all that from archives to make it available because we think it's so important for us to make sure that this material is available. And so next slide. This kind of gives you an overview of how we've been able to do this. This is an abbreviated timeline of how we responded to COVID-19 when the first cases came up in December and January. We started really adapting our existing training that we had to really start looking at MERS and SARS and looking how can we adapt the training that we already have to address this particular outbreak. And so we started in February and March, really looking at our resources and the Ebola training. And then we actually received funding from Congress in March of 2020 to start this process. And we really went, running from there, trying to make this happen. And so next slide. Of course, all of our training is based on hierarchy of controls. And we don't look at just the personal protective equipment, which is the lower level. We look at all of these areas as far as what we want to respond to. And so the administrative controls, engineering controls, substitution and elimination is all the things that we want to try to do to make sure that we reduce and in some cases try to eliminate exposure. And what we found out with SARS-CoV-2 is that we could not eliminate exposure for those critical and essential workers because they were out there doing their job and providing services to us. So what we had to do is we really wanted to look at engineering, administrative controls, and the use of PPE to make sure that those folks were safe. Next slide. So this is our approach, is that when we received that money, we implemented a training. At that time, we were just funding our next 5-year awards for our worker training program. And so we provided additional supplemental monies to our grantees to adapt and develop training that were focused on COVID-19. And so the goal was to increase health and safety awareness for responders and workers who face potential exposure to COVID-19. So we wanted to identify key evidence-based methods to prevent the spread of COVID. We wanted to develop a virtual training platform for frontline healthcare, emergency responders, law enforcement, environmental and critical care workers to be able to respond in this area. And we wanted to really build a cadre of these virtual trainers and advisors to deliver remote training to all of these different workers, and just didn't focus on infectious disease control, but it looked on mental health resiliency, and it really looked at the whole gambit on the PPE. And what we saw that it was just so fraught is that all of our healthcare workers were told, you have to wear an N95. N95 is the lowest level of protection for healthcare workers. You can use half-face respirators. You can use PAPRs, power supplied air. Those were things that were much more protective of those folks. And what we see now is that a lot of communities, a lot of hospitals have incorporated that into their emergency response protocols, where they actually have spent a little bit more money developing and buying those PPE, and that can be cleaned and reused across the board for our response. And it is definitely being used now dealing with this COVID variant and with the influx of more people going into the hospitals. So next slide. So we didn't just say, here's the money, move forward. We developed a series of different webinars from March 20th to March 15th and did Monday, weekly updates. We did technical topics, and then we did weekend reviews so that all of our grantees understood the resources that were out there, how to develop the tools that was necessary to revamp their training so they can do virtual when we're in lockdown. And we have continued to utilize that model to train workers, over 70,000 workers now, with the resources that we've done with COVID-19. We even developed, next slide, we did a partnership with Vivid Learning to rapidly develop a COVID-19 training tool that was asynchronous, and it was an e-learning package. So people can go and sign up, take the training in their own pace. And this is what the results are as of 5/15/2020. And I know we have much more, but I haven't been able to go back and update our slides on that, but I'll certainly share that with you. But that training is still available. You can go in and take it. And I think it's very important to make sure that people have the basic understanding of how COVID-19, SARS-CoV-2, the virus that causes COVID-19, how it impacts us, and what we can do to actually do the training under that program. Next slide. So in the training, we address some of the uncertainties about the novel pathogen. All of our training now, if you go to our webpage and our COVID webpage, which I'll share for you, is that we've evolved. We had talked about essential workers. Now we're talking about building training to return, to reopening. We're looking at tools in reference to what it means to be fully vaccinated. And then we really wanted to look at the building that capacity of not just our trainers, but for communities and businesses to adapt and utilize these resources to be able to work with essential and returning workers and what they do. Next slide. So we made 3 different sets of supplemental fundings. We provided funding to our existing grantees. We put out another notice of supplemental funding that we were able to provide $1.8 million to our existing grantees under our regular programs in our Department of Energy grants, and also with our SBIR. So the tools that they've developed is made available for everybody to utilize. And as you can see from this slide, the applicants addressed a lot of different things, from the curricula, building their capacity to respond, incorporating innovative technologies, especially some of our SBIR grantees, that material is available. And all of the funding that we developed under our COVID-19 supplements, you can have in this particular link here. It has the listing of each one of our funding streams, the different tools that have been developed, the training, and where grantees are doing training in each of these sites. And so under the next slide, you can see the target populations that we have been working with under this COVID-19 training. And so what's interesting is that we had already been working with these groups. So if we were going in to do a refresher training for HAZWOPER, we would throw on another hour of training on COVID-19 that would be site-specific. We would answer questions that people had. If it was dealing with airport workers, what would be their folks, the TSA workers, what would be their concerns and their issues and how to protect themselves. We would help them do a hazard job analysis to say, where are your immediate hazards? And so we help them to develop tools and resources to be able to develop protocols within their existing training. And one of the things I think is important for us to really look at is that all of the tools that we developed, our National Clearinghouse for Worker Health and Safety Training always develops what we consider those training tools. And if you go to the next slide, all of our training tools are available online. So all of our grantees, when they develop curricula, is available in the curricular catalog. All of the tools that we develop can be adapted and reused to use from any different group. So if a local government wants to take it and adapt it to a particular target population, if they have an issue there, we can do it. We have what we consider a COVID-19 toolbox that features a resource list. It has fact sheets. It has a workplace checklist for non-healthcare industries. And then even stuff that's like a fact sheet on prevention of eye exposures from an infection. And so if you go to this next slide, which is 32, you can see some of the training that we've developed and some of the tools that we have available, and they're available in English and Spanish. The booklets, so you can download those. We have an instructor and a user's guide, and then we have all of the supplemental documents and fact sheets available for this. And this particular training training tools have evolved, and we have dates associated to those with the most up-to-date information that we have available. Now under the next slide, which is slide 33, we actually helped to develop a COVID-19 workplace checklist. So not just workplaces can use this, community-based organizations, if they're reopening and doing things, you can adapt it. I'm currently working on workplace, a checklist for my sorority. If we decide to come back and do activities at the Delta House here in Durham. So I'm developing this checklist and looking at the controls that we need to put in place to protect our members when they come back. I've also provided some additional tools to several community-based organizations here in the North Carolina area and churches to let them know that there are some great tools and resources out there for them to look at. How do they adapt what they do to make sure that they're safe if they're bringing people back. Next slide. Here are some of the training tools that have been developed in modules. This is one of the trainings that CPWR were able to take our training tool and make it into a mobile platform. They're in the process of updating that with the latest information dealing with the Delta variant and of course with masking and all the other issues that are coming on right now. So that's a tool that's available for you. Next slide. Dealing with our SBI grantee cell podium, they actually developed a just-in-time essential worker COVID-19 mobile awareness. And what it did was really put in 10 different modules derived on the worksheet, the work checklist, and then all of the tools that they could find where they were able to push these modules via text messages and emails to different businesses if they needed to have access to information. Look at the next slide here on 36. It really shows you how they were able to do this. So they actually had different scripts for different work environments, and they would show the hazards. They would talk about the actions that you would need to do to mitigate it. It would talk about hygiene and the tools, and even made it into a game, which is hygiene trivia, for you to look at it. So you can adapt it based on the organization that you work with. And then here on 37, we actually worked in collaboration with the American Industrial Hygiene Association to actually develop a guidance to protect volunteers from COVID-19 during natural disaster response and recovery. Because one of the things that we saw is that the way we normally would do response and community-based organizations coming out and helping, that we really need to make sure that they understood to provide them with key information on how to protect themselves from SARS-CoV-2, and that you could not do all the stuff that you really had done in the past, like going and being deployed to do the response when there's a hurricane or wildfire. You might want to look at more virtual response. How do you actually make, for example, elderly folks would tend to work a lot of the food pantries and help out with the American Red Cross and delivering food. We strongly advise that those individuals stay at home, do more virtual work, do more work as far as helping to support younger people who are actually going to be able to respond, or those folks in those local geographic areas to actually do the response work in their general area, and then help. We will provide other tools and resources to help them out, but that material is available. And actually AIHA has some great resources on COVID-19 dealing with every industry in reference to how to develop these workplace control plans for those activities. And so lastly, I want to just share with you a couple of things that I think is important. The next slide, we just made our last group of fundings, and we actually developed what we consider COVID-19 recovery centers to promote health and safety and recovery training for essential workers in their communities. And we wrote an article on this that's in our E-Factor from May of 2021. It really talks about how these programs are being set up. And so, we have 8 different COVID recovery centers, but they're doing training in about 20 different states and working with different groups to make sure that we're mobilizing all of the current resources that we have in this program to be able to move forward to address any new risks that's coming out. So all of the work that we're now done with the selection and use of portable air monitors and filters and other types of tools to deal with ventilation. These centers are making sure that we put this information out there on the street. All of the work that we're dealing with mental health and resiliency, what we consider now with the increase of substance abuse and opioid, we're actually incorporated into these centers is really holistic in the work that they're doing. And so I wanted to now end with just a brief overview of our environmental career worker training program. We've been doing this program since 1995, and we celebrated 25 years. What we have done is really develop programs in collaboration with community-based organizations, union-based groups, to provide training for unemployed or underemployed individuals to get work in environmental remediation in the construction fields. And we've worked in over 30 communities and with over 200 different community-based organizations to do this program. And currently we have 6 grantees that are working with 25 different CBOs. And as you can see from this slide here in the pictures, that we worked doing a lot of things as far as changing people's lives and building careers under this particular program. And even during COVID, of course, we couldn't do all the things that we wanted to do, but we still had a 59% job placement rate as a result of this program. And that's because of the great extensive training and best practices on life skills, mentoring. And we were able to work with those grantees to implement COVID control protocols, to do a lot of the training virtually, and then any of the hands-on training, it was done like with 5 people coming into the training at one time, and they had 2 or 3 instructors that were dressed out and PAPRs and half-face respirators, so that we made sure that everybody was protected when they did those one-on-one training. So next slide. Just wanted to share you is that we've done some great analysis under this program, looking at like economic impact, and what we've been able to find that with our $3.5 million investment, this program generates over $100 million in return. That is in the area of effects on earning, higher earnings. Grantees are 59%, graduates are 59% more likely to get more earnings as a result of this training program. We've showed that it shows a reduction in workplace injuries. It reduces hiring costs, and it also deals with reducing recidivism or crime-related costs as a result of people getting involved in this program. And what we've been able to show that the program has generated over $2.3 million in matching funds and in-kind contribution. And this report is available for you to look at what we've actually done. And in slide 41, I just wanted to share with you one of our grantees and what they've been able to do over the years since they started the program. Their financial survey of their graduates showed that when people came into the program, they were making around $14,500. And as a result of being in this program, now graduates are working in all different types of building trades jobs and dealing with construction and all over the New York, New Jersey area. They're making over $96,000 a year. They have 77% of them have increased earnings over 50,000, 24% over 100,000, and 30% of those individuals are owning homes, and 30% of them are debt free. And so we're talking about individuals who are unemployed, were living on assistance. A lot of them living in poverty. A lot of them were literally living on the street. They were homeless. And as a result of being in this program, they've been able to do so much more with their lives and benefit their families. And so we're really excited about the work that's been going on under this environmental career worker training program. Next slide. Here is some of the major findings that we had that was really talking about people's lives and what they've been able to do. I won't go into all this, but I have to say, when we look at some of the great work that some of the students who graduated from this program are doing right now, it's just phenomenal. When you think about a person who was homeless, which was what we had with Mr. Studevant, he's now the business agent for the Plasterers Union, and he's now on their advisory board. This is what we're seeing happening under this program. So if you go to the next slide, you'll see information on what's going on with some of these students. And then slide 43 really talks about what our current funding that's going on right now. We've got a new grantee, Sustainable Workplace Alliance, which is out of Florida. They're actually doing a training program in Orlando and our first program in San Juan, Puerto Rico. But we have a couple of new programs out of Roxbury, Boston, and Indianapolis. And then we're also working with various tribal communities in Alaska through our program out at UCLA. And so we're just delighted to be able to continue with this program. And in the next slide, It really talks about what we're doing now. The ECWT has been identified as a pilot under the Justice 40 initiative. And what we want to try to do is replicate this training program to more communities to really show that this program is going to not just 40% of the benefits, but 100% of vulnerable communities get access to the training that's being done under this program. All right, next slide. Here are some of the future directions. I think I've covered some of this already that we're going to continue to do under this program. And to let you know that we are here to work with you in collaboration. So if we have grantees, if you need to have training dealing with lead, if you need to have training dealing with job creation and working on hazardous materials and response, we can try to get our grantees to work with you to do the training. So for example, with lead, if you need training on lead RRP, or if you need to have training for inspectors for lead, we can offer that under our training program. Next slide. Once again, here's the training on all of the curricula and available. So all that material is available for you to download and utilize. The curricula that we have available for each one of our grantees, they're putting that up online so you can download it and adapt it for what you need to do. So I want to say thank you for allowing me to share with you some of the resources that we've done here at Worker Training in collaboration with our grantees. So thank you for listening. It's in our last slides, and just wanted to know what questions you might have.
Great, thanks so much, Sharon. That was a wealth of information. I don't have any questions in the chat, but if anyone wants to ask a question, you feel free to unmute or put your questions in the chat and I can read them out to Sharon.
And this should be a conversation. So if there's a need that you've had that maybe you need to have a training or need to have additional information, because we develop so many fact sheets that our grantees do that's site specific to work with different groups and organizations, we can try to help you to get access to those tools and resources that are developed under our grantees.
And hi, Sharon, this is Lenora Smith. I'm in Durham, North Carolina, and I was really fascinated by your presentation because we are currently in the midst of increasing the number of certified renovators in our area. And I thought, wow, this is really good to just have a real comprehensive program around training. So I'd really like to connect and find out more about how to, I guess, partner with NIEHS to develop these environmental training opportunities. I was just blown away. This was just such awesome information, and I just like to be more involved with it. I'd love to layer this type of training in the training program that we're creating.
Great. Well, Lenora, one of the things that I encourage all of our folks to do is that I'll put in the chat box here a link to who we fund. This is one of the prime ways to go out because we develop a cooperative agreement with our grantees. We provide them with funds and resources. We continually do technical workshops and updates and share best practices with them. But they work with community-based organizations and groups like you to develop site-specific training. So for example, we can go and do a search of our database to find out who's doing training in North Carolina on lead, asbestos, or whatever you might need. And then we encourage you to go work with that particular grantee to set up training, whether it's virtual training, which is probably going to be most applicable right now with the Delta variant. But whenever we can come and do training and on site, we can do it because our grantees, we provide them with the funding to make that happen. And so we encourage you to do that. And especially with some of our grantees who have already been coming to North Carolina with the chemical workers and then through our community college consortium. We've got training that's going on in Durham Tech at several different community colleges across North Carolina that can be adapted and utilized for the training that's being done with your folks. So I'm going to look up those links right now and start putting in the who we fund so that you can really get a chance to look at some of the work that we've done. But you can get a lot of that just based by going to our webpage and looking at who we fund.
Great, thanks a lot. I appreciate this info.
Great.
Hey Sharon, this is Nisha. I'm curious to know, Specific to North Carolina, have most of these opportunities come through the community colleges and HBCUs and other programming?
It's been a mixed bag, actually, Nisha. It's been a lot of our union-based programs, especially the chemical workers and the steel workers, because they work with a lot of community-based organizations. For example, the steel workers, they have a program with the National Day Laborers Association. So every worker center that's out here, they've been working on providing training specifically to those groups, and a lot of that training is bilingual. So they've actually gone out to street corners at Home Depots, Lowe's, or whatever after disasters, and providing training to them on what they need to do, which we can consider on the job training right there, providing them with those tools. And they also hand out packages of PPE and other supportive material, because we know a lot of these individuals who are picked up to go do work don't get the resources that we need. So we provide them out with the booklets and a PPE package to help them. But what we wanted to do was to train a cadre of those workers in collaboration with those worker centers so that they can actually do this training on their own. That's why we did the training with Fe y Justicia in Houston, and with AmeriCorps, and with some other worker-based organizations, to make sure that that's something that they incorporate into what they do. And so the long-term recovery group in Robeson County, we have gone down and done multiple training there in Cumberland, and I think in Robeson County, to support a lot of those groups who are still helping with cleaning up after Florence and those type of things. But we can do more of this type of training, because our grantees still have monies to do this, and we can certainly make sure that we bring people to those organizations so that they can get their training.
Great, thank you.
Yeah, and then you asked about the community college. Pete actually has a very interesting model, is that they actually provide training to the trainers that are at these community colleges, and then the community colleges go out and do the training. And the community college kind of set up how their framework, but when we actually deploy them to respond, all of the key health and safety trainers from the community college, and it might be about 10 to 15, actually go out and do the training in the field where they're needed. And it's based on how they're being deployed. So we can certainly garner more support from the national organization if there's a specific need in a specific community based on some type of exposure to the programs. But a lot of the work that we do there under our hazmat disaster program, there are a lot of great materials and tools and key site-specific training that can be utilized by all of the folks here on this call.
Great, thank you.
Mm-hmm. And I did put in there the reference to who we fund. And I want to make sure that you understand all of these programs do training in multiple different places. We train in every state and US province here. And so this training is available. And for example, we even have a grant with the Deep South Center for Environmental Justice, and they work what they consider their HBCU consortium. So they have a great relationship with multiple HBCUs, even in this area. They train the HBCUs, they train folks on CERT, which is Citizen Emergency Response Training. They actually provide the training for the environmental career as an example of the work that they're doing. So they do a lot of environmental justice training and disaster response based on the work that they've done, from everything from Hurricane Katrina all the way up to Harvey that impacted the Gulf Coast.
Great, thanks so much, Sharon. Are you okay with me including your contact information in our meeting summary if people have other questions later on?
Oh, absolutely. Please do. Now, I won't say I'll be the one to respond back. I might send it to one of my staff who's working on this. But what we want to do is that if there's any help that we can provide, we will try to do it for you, or send you to a grantee that we know that can provide you with some training and opportunities or access to resources.
Great. Thank you so much. I really appreciate you speaking with the group today and providing all the resources and slides and your expertise.
Oh, no problem. This is what we're here to do. We're a government funded program. We want to make sure that these resources get out to as many people as possible.
Great. Thank you so much.
Sharon?
Yes.
Do you work with Chip Hughes?
Actually, Chip Hughes was my boss, actually.
Okay.
Prior to this, I took over for him in February of 2021 when he left to go work for OSHA as working as the Assistant Secretary for Pandemic Response. Now he's actually retired right now because he helped to really set up that the OSHA EU, the emergency I'm drawing a blank of the actual name of it, the emergency standard for healthcare. And then also set up some other tools for the National Emphasis Plan and stuff. So he said that he did what he went there to do, and now he's trying to retire and spend time with family and friends.
It sounded like the work I knew Chip was doing. So.
Absolutely, absolutely. And actually, his wife, when he retired, set up a fund at UNC School of Public Health, Getting School, to actually provide funding to researchers, undergraduate and graduate researchers to do working with communities-based organizations to do this type of work. And so we were just delighted that they were going to, instead of us giving money to him for retirement, that we would give to UNC to help more programs to do this type of work.
Well, I won't tell you then, well, I guess I will, but don't tell Chip that I remember what he did with his diploma from the School of Public Health. He used to have it pinned up on a dartboard, I think it was. I'm not sure. This was over 30 years ago when he worked with the Clean Water Fund, but I'm sure he has gotten a clean one, and it is in a sparkling display case at this point.
Absolutely, he certainly did. And one of the things I think is so unique about what Chip has been able to do is that he has always been a grassroots type of person. So he utilized his background to really focus on that, and his legacy has really pushed us to stay in that same vein of the work that we do with the worker training program. And we're going to continue to work with communities that need our support. And we certainly want to make sure that we can provide you with those resources to help so many of the communities that you work with.
Thank you.
Thanks, Ed.
Thank you.
Great. Thanks so much, Sharon.